Hello and welcome to Catholic Parents Online, a YouTube and podcast channel where we share tips and resources on Catholic parenting. This is brought to you by the Theology of the Body parenting team of the Apostolate for Catholic Truth. Presented with the lens of the theology of the body, we will see how we can be a sincere gift of ourselves to our kids in ways that will help them find true happiness and flourish in accordance with God's wonderful plan for each and every one of them. My name is John Hui and I'm your host for this podcast. Today we will be talking about anxiety and self-harm in children. In 2020, Singapore reported 452 suicides, the nation's highest count since 2012, amid the isolation and psychological distress brought about by the COVID-19 pandemic. Among youths aged 10 to 29, the number of suicides rose by 7% from 2019. And in a report released by the Ministry of Health last year, that is 2021, mental well-being was a challenge for 52% of the youth who were polled during the second half of 2020. Among the top stressors cited by the youth, 53% cited anxiety over the future, 41% over stress over finances, and 39% worried about academic or work performance. No doubt, this was probably complicated by the COVID-19 pandemic. Yet, the figures do suggest that not all is well, and mental well-being is indeed a huge challenge for the youth of today. As for self-harm, a study among Singaporean adolescents in an outpatient setting reported that the prevalence of self-harm has been consistent at about 23% from 2013 to 2018, which seems to be a rather worryingly high figure to me. With these in mind, we are very happy to have with us today Dr. Penny Tok. Penny is a psychologist in private practice who specialises in developmental, educational and counselling psychology. She has taught and practiced psychology in Singapore, New Zealand and in Europe. While she supports families in a wide range of areas, she has a personal interest in autism as well as in anxiety in children and youth. Penny has been back in Singapore for the last 8 years and, while running a busy practice, manages it in a way to ensure she has both quantity and quality of time with her husband and 2 young children. Welcome to the podcast, Penny.
Hi, thank you for having me.
Yeah, so we are very happy to have you with us because it's a very, very important topic which I'm sure many parents would be quite concerned about. Yeah, so we're really happy to have you with us. And perhaps as a start, would you like to share with us a little bit about your family? You know, how many years have you been married and how many children? How old are they?
Well, my husband Paul and I have been together we were just doing the sums the other day, trying to calculate. And we figured out it's been about 13 years we've been together. We've got 2 boys. The older one is he'll be 8 this year. And his younger brother's will be 5. Will be 5 soon. Yeah.
Okay. So what have been your biggest challenges and joys raising your children so far?
I think one of the things which we've kind of learned along the way is when people talk about planning a family, the focus has always been on the fun parts, having someone to play with, to raise them, discovering more about your children and being with them. But I think a lot of times people don't really talk about the tough part, and parenting is really, really tough. And I think it's one of our best friends said to us, "Oh, it doesn't get any better," and we were panicking at that point. We're like, "What do you mean it doesn't get better?" And I think what he meant was the challenges change along the way. So initially it was the fatigue that really struck us. You look on Facebook, social media, everyone's posting very happy pictures of them, having fun, going out. No one's posting pictures of, like spew on the floor, them covered in diapers. And
yeah, you're just too tired to take those pictures, I think.
Yes. So I think that was one of the key things, is the fatigue, how much time you really have to dedicate to the kids. And I think another one which a few friends and I have talked about in quite a lot of depth actually, is how children can really get to our emotions, not just in the good way, all the feel good feelings that you have for the kids, but also in terms of bringing to front our own anxieties and our own frustrations, and making our own personal shortcomings really obvious, that we then have to put aside some time to work on those and to acknowledge, as well as to work, like I said, to work on those as well. So those, I guess, would be the biggest challenges.
Now, I understand you have an interest in the areas of autism and anxiety in children and youth. Would you like to share with us what inspired or motivated you to go into these areas?
I think it started with before going into university, just like every other or most other kids, you kind of go, what am I going to do? What course should I take? And I knew that, the more traditional routes of business, accounting, those were not interests of mine. So then, spent a whole lot of thinking and wondering about it and reflecting. And then I realized, oh, actually, I kind of like being with kids and youth and helping and working with them on some level, which then also then became no, I don't want to be a mainstream teacher. My sister went into that route, but for me, I realized it's not for me. So then I actually have a cousin who sadly passed away already, but she had Down syndrome. And so then, interacting with her made me kind of realize, oh, actually, I think this is a field, kind of ticks all my boxes. I want to work with kids and youth. I want to be able to be in some kind of helping professional. So that was it. And then at university, we're also very lucky that there was a clinic that worked with autistic individuals. So that was really kind of the turning point in terms of, yes, I want to work with autistic individuals in particular. And then a lot of it I'm realizing that with a lot of autistic people, there was a lot of anxiety in the kids themselves, anxiety with the parents, anxiety of teachers working with them. So then, yes, anxiety then became the other thing that kind of popped out on my radar. And I thought, okay, that's something I want to deal with. And also, I think experiencing anxiety myself, it was a personal journey in addition to wanting to assist others, but a personal journey in learning how to manage it myself on an everyday basis. Yeah.
On this topic of anxiety, what do you think are the main causes of anxiety facing children and youth today?
I think it's quite different in different countries. So, like having that experience in New Zealand, there isn't the academic stress, at least not from a very young age. So, if I'm looking at anxiety across all children and youth, I would say the culture does play a bit of a difference as well. Not that, people in New Zealand or in Europe do not have anxiety, but I think one of the things that's kind of come up quite clearly in my experience in Singapore is anxiety with regard to education and learning. Because from a very young age, the high stakes kind of education setting tends to be one of the key things. So even some of the youths that I work with, if their anxiety kind of worsens or gets a bit more significant when they're in a teenagehood, when we kind of look back, a significant number, we realized that, actually the anxiety started to pop up when they were in primary school. Exam stress, concerns about being able to perform or underperforming, or, so there, I think definitely in Singapore, somehow the education side of things seem to make that a challenge. And then I think for some of the other individuals as well, I think it's just the fast pace of work sometimes, like parents trying to juggle everything and children with their busy schedule. So a lot of taking in, but not a lot of offloading of that stress until it kind of piles up. But I am very glad to see that, at least in Singapore context, there's been so much in terms of even at the primary level, secondary, polytechnic level, university, so much more emphasis on mental health and trying to catch it early rather than let it snowball. So I know I kind of deviated a bit from your question, but so I think, there are different issues. Some, of course, in terms of anxiety and its causes, some are, they are genetically predisposed as well. But then something in their life kind of flips the switch and then, anxiety kind of develops. And like I said earlier, if it's not managed early enough, then unfortunately that anxiety can lead to unhealthy habits, and then it just gets worse as they grow older.
Yeah, I fully agree with you. I think that we need to check these out as early as you can. And I think at this point, I think our parents have a very important part to play. And because they are the primary caregivers, and they know their children best, well, at least they're supposed to know their children best from very early on in childhood, right? So what do you think parents can do to address this issue even before it crops up? Perhaps what we in public health would call primary prevention. What do you think parents can do in this area?
One of the key things is actually, I think would be good, is to check our own anxiety levels. Because like I said, that's anxiety is something I deal with. And sometimes, even my husband reminds me, Penny, is that your personal anxiety that's kind of, or reflecting your personal anxieties, or is it our son's anxieties? So I think one thing is, yes, being able to set aside time to, kind of work on ourselves, take care of ourselves, because, as the old saying goes, you can't pour from an empty cup. But I think because the giant parent guilt, it's always trying to take care of them first, right? Like sometimes I have to remind people that come in as well. Remember, even on the planes, they say take care of yourself first before you put the oxygen mask on your children. So I think that would be the first thing, to take care of themselves, because when they are cared for, parents are cared for ourselves, then we are in a better position to actually spot some of the signs and symptoms. The other thing is always to just keep talking to your children, because one of the things that studies have also shown that even if the child is struggling, but if the child is willing and able to tell you about it, that itself is a major factor, because I'm not keeping it in, I'm not worrying, I'm not building it up inside of me. I actually have an outlet, and that would be the other thing. And it doesn't have to be not every conversation has to be a deep and meaningful one. Even if it's just talking about school or playing a game together, because that's how children kind of really communicate, is through games. And through then, then sometimes some of the things come up when they're talking to parents. One of the things we have at home here is what my son terms chitty chatty time. And so before bed, they try to get, mommy, it's chitty chatty time. But then I have two. So we have to roster both of them, one and then the other. And even just stealing little bits of time, like walking my son to wait for the school bus that comes. We kind of use all those little periods of time, the transition time, to try and establish a connection, right? Because quite often we are so ready to just go, but then just putting the pause a bit. And I think, so those would be the key things. And then for parents, what we usually ask parents who are concerned, right? The two things we say is, look for things that are new behaviors. So new behaviors like, anger, thought, words that they use as well. So if you notice a change in the tone of the voice, the words they use, their overall emotional health that you can observe, the observable parts. And then also observe for kids if there are areas where things that they may have been interested before, like activities they're interested in, but they suddenly stop being interested in those, so we try to encourage parents, just look for changes in diet, for example, sleep patterns, so these would things to just kind of be mindful of. And then if they notice that, okay, it's starting to have an impact in terms of relationship at home, school performance and such, then maybe it might be time for them to, go and speak to someone about it and raise their concerns.
Yeah, it sounds like it will be very important for parents to, number one, maintain a good line of communication with the children, and number two, having a very good relationship with them, whereby they can just be bonded with them through various activities or even non-activities, but just being there for them and understanding the children well, so that the moment they find any difference in behavior and interest, they might actually have to be alerted. Am I right to say that?
Yes. Yeah. Because it's the same thing where if, let's say, kids go for, psychotherapy or any kind of support, there needs to be engagement. Right. So that's where the thing we always encourage parents is, we know you're anxious about them, you're worried, you're probably even frustrated. But the more we display these big emotions, younger children in particular, and even youth, they then get overwhelmed with the emotions, and then they decide to clam up. Right, they clam up, they can't talk to us anymore, and then we get shut off from what's happening inside. So yes, definitely the engagement and just spending time with each other, because quite often we get parents that say, I don't know, I'll go find out. I was like, how do they sleep? I'm not sure. The helper puts them to bed, let me go home and find out. And I don't, it's not their fault, it's just kind of the way life is sometimes. So it's just that, I guess, yes, when there are signs and symptoms that need to pull the brakes, and then we might need to pause everything and start paying a bit more attention.
But what if parents realize that there is some change in behavior and some change in their children's behavior, so to speak? So what do you think parents can do if they do suspect or are concerned that their children may be having a higher level of anxiety than they can cope with?
So one of the things would just be to go back to the kids themselves again, try to, chat with them, I would advise against asking them directly, are you anxious? Are you worried? Especially for younger kids, because then we're priming them into thinking, oh my gosh, now I am anxious. So even just, talk to them. And then if there are concerns, go and seek help. There are various services out there, that they can, various channels. I think a number of people that we've spoken with, their first line is talk to friends, talk to family members, they have children of similar ages, and then, see where that takes them. And if the concerns really grow, then go and get some professional support.
Yeah, that's very good advice. Thinking about the possible consequence of anxiety, right? One of the things we mentioned just now was actually self-harm, all right? And it seems to be something which affects quite a number of our young today. Would you like to explain to us what this phenomenon is all about, and what are the causes of self-harm? How perhaps prevalent is this in our society? And what should we as parents look out for to prevent this and to really intervene as early as we can?
Yeah. Incidences of self-harm don't just start, in terms in that way. There will always be little signs, like we talked about, little signs of anxiety, either withdrawals or changes in behavioral patterns. And also when individuals do start self-harm, they're very cautious and very careful about hiding it. So typically, even if there is self-harm, very often parents and family members or teachers themselves don't realize it, because it's either done, for some individuals, like girls in particular, they do it between their thighs or under, on their wrist where their watch will cover it, or, somewhere where it can't be seen. It's not common for them to do it in areas where it's easily visible. So it will be hard for parents to notice. And usually it comes with just an overwhelm. They don't plan to self-harm. It just happens as, they just mentally are unable to cope anymore. And then it turns into a physical means. So quite often then, if parents do notice as well, so one of the first lines is we always remind them, just keep them visible, be vigilant. So especially because we don't want it to escalate. Right. And if your child, regardless of what age your child is, brings it up to you, stay calm. Because we don't, like I said, it takes a lot for them to open up to someone. So I would encourage parents to stay calm, have a chat with them about it, seek some help. But one of the things that would be useful is to remove, at least initially, just to remove things that might be a bit dangerous, or, items that might be a bit, might put them at risk. And, like I said earlier as well, increase visibility. So spend more time with them. If studying or revising for exams, that's what happens to a few of our kids, when they're doing their homework, and then it gets overwhelming. So, maybe moving study areas to the living room or to the dining area where they can be surrounded with other people. So then it just breaks the whole process and the habit of doing it. So those would be kind of the key things. In terms of prevalence, unfortunately, I don't have those numbers. But yes, definitely, I think the numbers you talked about earlier in terms of the increase, that is very alarming. And I think especially in the Singapore context, it's not just the pandemic, because there's been an upward trend already. So we just need to be vigilant, be mindful, and, mental health is just like, primary health. It starts way before. We don't want to jump in when it's already happened. So just taking that time to take care of ourselves.
Yeah, that's right. Then actually some of the younger patients I've seen who actually have expressed some possible intention of self-harm, or actually have practiced self-harm. A number of them actually shared with me that it was the undue expectations that their parents placed on them, on their schoolwork or on their achievements in other areas, and sports and ECAs, things like that. Do you think that could be an important part of to play in development self-harm and anxiety?
I think sometimes, yes. I wouldn't say all, but yes, sometimes. I mean, we've had, kids come in and they're very tired, and I'm like, oh, why are you so tired? What's your schedule like? Oh, I've got school in the morning, and then I come home, I rest for half an hour, and then I have to go off for tuition, and then I'll come back, and then I have to do my homework, and then I rest for another half an hour, and then it's dinner, and then I have tuition to 10 p.m. And I'm like, you have tuition to 10 p.m. So I think sometimes that is a cause, but of course, like I said, sometimes the parents can be, I've also met parents who are the most chilled parents, who don't place any demands on the kids, but the kids place the demands on themselves, right? Or it's the school environment. So it's multiple factors. But yes, I think it does exacerbate the situation when they just do not have any downtime. Yeah.
Yeah, that's true. And I think basically, since this podcast is for Catholic parents, all of us, one of the things we would most likely do is to pray, right? Yeah. So I think the faith does play a very important part in many of our family lives, I believe. And do you think, are there any studies which you're aware of that show that children and families with a higher practice of the faith have actually lower risk of anxiety and self-harm? And if you do, can you share some of these findings with us?
I don't have a lot of detail, but there is a study which is a meta-analysis of a number of various studies that they've looked all together to look at the different aspects of faith. So looking at just, religious faith, looking at self-harm as well, because we know some religions actually against it's not a good word, but not for suicide and for good mental health. So there are some studies that actually show that religious faith does act as kind of a support system in the sense that helps to prevent mental health, not to prevent anxiety, but then not only that in terms of the prevention, but also in terms of managing it. So managing chronic stress, chronic anxiety, there's quite a number of research out there. So I'm more familiar with research papers that look more into the ritualized behaviors of religion that can also be very soothing, very comforting. But I think some point to the the relationships that we have with God in our religious practices that can be a real buffer as well as a real support in mental health.
Yeah, I agree, because actually even in my own area of life in this area and parenting my kids when they were younger, quite often whenever issues came about and they were quite stressed by certain things and everything, they came to us, we said, let's talk about it. And after a while we said, okay, I think let's pray about it too. Yeah. Because really there are so many things that we can't handle, to let the big boss guide us, we tell them. And that actually does help them as well, because they know that there's, in a sense, someone else in charge and that they themselves are not the ones who are responsible for all the outcomes in their lives, but they just have to trust that, things will turn out well somehow. Yeah.
Yes. Yeah. I think that really helps because, quite a number of people, they've come in and, they've gone for, like religious-based counselling as well. And there are definitely a number of people that I've encouraged. I said, well, you do what you need to. And sometimes it really can speak to you on a deeper level, not just on a mental level, but on a spiritual level as well. And that, very often that seems to make quite a difference in terms of their recovery as well.
Yeah. So actually, if parents now, let's say they do find out, of course, they would like to talk to the children about it, spend time with them, pray about it. But are there any perhaps helplines or avenues that you recommend to parents to turn to if they need help? For example, professional help, should they find out that children are at risk of further self-harm? And so if so, what can our parents be referred to?
So for in Singapore, of course, they can go through the public health system route. The public health system route, meaning they can go through, depending on the age of their child, so they can go through, for example, the polyclinics to get referrals. I do know a number of parents that have explicitly said to me, I'm a bit concerned about going that route just because of waiting time or, but so those are some of the concerns. But of course, there are private practices that they can go to as well. But of course, the cost, that would be quite a bit different. But I know that for example, the Catholic services, some of the people I've worked with, they go for the counselling services available there as well. And I think it was just last week that I referred someone over as well. So they can do either with the public route, which the polyclinic will refer them over to either institutes of mental health, but there are also satellite clinics around Singapore, not necessarily having to go all the way to Bangkok. But also, of course, then private practitioners around that they can go to too. And there are, like I said earlier, there are a number of non-profit organizations that they can turn to for help as well.
Yeah, I guess from the Catholic point of view, I would what comes to mind would be Catholic Family Life with their counselors. I think as well as Morning Star.
Yes.
And if I'm not wrong, Montfort Care as well. I think these are some of the organizations that do have counseling services for us who might need that. I see. Okay, that's great. And after what we've discussed so far, it is possible that some of the parents listening in might feel a bit guilty if their children do exhibit such behaviors or have exhibited such behaviors, and they might in a way feel responsible for it. But I'm sure there must have been many other factors, like you mentioned, right, that would have contributed to the distress that children would have felt, so for these parents who might feel a bit guilty perhaps, do you have anything to share with them and to encourage them in this area?
I think the guilt is, to be expected, because, as parents, we put so much expectations on ourselves to care for our kids. And then when we miss something as big as this, it's not surprising that they feel the guilt. But I think we need to move on from the guilt, just take that guilt if you have any, sit with it for a few moments, process it, and then kind of let it go and move on to the next stage. Because it's kind of like with the number of the people that come to me for support, I say, look, the past is always important to look at, but don't stare behind too long, because you need to look forward as well. So just move on, think about support services, and find someone to support you as well. So if you do still have that guilt, that you're finding it difficult to let go, chat with someone about your own guilt. And then, just move on, find somebody to help you, take you through the journey, because it is going to be a difficult one. So just gather people around you and your own support systems, and, find a way to heal both your own guilt as well as help your child.
Okay, yeah, I believe that's absolutely true, actually, Penny. I fully agree with you. And I think one of the things we really need to do as parents is to be able to forgive ourselves, right?
Yes.
Yeah, I think sometimes we just can't do so because of the immense guilt we feel. So I think, yeah, it's so important for us to really have that grace to be able to forgive ourselves. So maybe start off with going for a good confession and really finding solace in our Lord, that they can actually find comfort in Him, and really get that forgiveness from Him, because He can, nothing is beyond His mercy, right? So I think we need to really entrust ourselves to His mercy and then move on from there. Yeah.
Yes.
Yeah. Now, I understand you're having a kind of a session, a public Zoom seminar for parents on ADHD on 26th of March, 2022 this year. Would you like to share with us a little bit about what you are going to talk about and what you'll be presenting that morning?
Okay, so yes, this is part of our series that we hope to do. So we started it in December. The first one in December was on autism, but we're hoping to do every quarter we do cover one area, and it's a free session for anyone who's interested to attend, be it a parent, a teacher, anybody that really wants to learn a little bit more. And the key idea behind it is to share information about these disabilities, so that people can understand it, accept it, and then help each other in this journey. So we're looking at attention deficit hyperactivity disorder. It will cover basic information about what ADHD is, and the emphasis will be more in terms of, so now that we know a little bit about it, what can we do to help these individuals? So be it from a parenting point of view, but then also from a teacher's point of view, and just as a human point of view, really. So, to understand a little bit more about this disorder.
Yeah, I think it's something which is very ill understood by many of us, even among those of us in the medical profession and such professions, right? Very often we don't have enough grasp of the issue, and we might not be able to guide our own patients sometimes adequately. And I find that in my own practice too. And I think this is something which should be useful, not just for parents, but even for professionals, I would think.
Yes.
Yeah. Well, Penny, it's been wonderful having you on this podcast, and wondering, before we end off, would you like to have any other final words of advice for our parents before signing off?
I think the main thing would be, don't be so hard on yourself. It's hard enough being a human sometimes. We've got the additional responsibility. We want to be, with God's grace, raise the children as best as we can, but we are human. And we do make mistakes. It is a journey, and seek help. Speak to someone. Talk to your husband, your wife, your family members. Just speak to someone if you have concerns and care. But also mainly, just remember to take care of yourself. Parents need care too, and not just our kids.
Yeah, just like what you said, right, on the aeroplane, give yourself the oxygen first before you can attend to your children, isn't it?
Yes.
Yeah, that's right. So the oxygen in terms of the supply that we can get from our Lord upstairs, right? The oxygen we need to share with ourselves and with our spouse. And then when that is stable, we can share it better with our children, isn't it?
Yes. Yeah.
Well, it's been wonderful having you on this interview, Penny. And it's been really quite a grace to have you here. Thank you very much for being part of this. And we hope to see you sometime soon. Perhaps sometime later we can talk about some other issues like maybe even ADHD perhaps and other special needs that children might have and can be a challenge for parents.
Yeah, sure. That would be nice. Thank you.
Thank you, Penny. So take care. All the best then. Okay.
Thanks, John.
Welcome. Well, thank you everyone for listening in. I'm sure we had a fruitful time listening into Dr. Penny Tok, clinical psychologist in private practice. For those who are keen to attend her workshop on Saturday, 26th of March 2022, you can either email her at admin@drpennytalk.com or call or message her office at 88584153. Till we meet again next week, when we'll be discussing with Dr. Jennifer King as to how we can help our children flourish. Take care everyone, and may God bless you and the family always. Goodbye.